IV treatments using NAD are popping up at detox clinics across the U.S. with a promise to help cure even the toughest addiction.
I had trouble with chronic fatigue, trouble thinking. And after this 10-day treatment of NAD, my pain disappeared. I had this amazing energy. And ever since then, I've done everything that I could to get NAD out there to other people that might be suffering in the same way.
We're back debating an unconventional treatment called NAD therapy. All right, Dr. Basha, you've stated your position about NAD not being a good treatment for addiction. What do you think? How do you explain Tom's success with it?
Of course, there are people in the US and elsewhere who recover from addiction, sometimes with no treatment whatsoever. But again, the studies repeatedly over and over and over again are showing that as compared to detox, as compared even to counseling, as compared to residential treatment, as compared to peer support groups, that the most effective treatment is medications. And so again, I think the urge here is not to push people away from having options, but rather to encourage people to at least look at the option, if not go for the option that has the most evidence. Physicians and policymakers and researchers need to be crystal clear that among those options, we have some that are the best, that we have studied over and over and over again.
So Dr. Repass, if someone truly wants to investigate NAD therapy with someone that knows and has used it and has done the research and has the experience, how would you even suggest they go about doing that?
I would make sure that they're an addiction specialist. I would also recommend that they are part of our little society, the Brain Restoration Plus Society, Dr. Medier developed from Springfield Wellness Center, and finding somebody who's using an NAD that has been tested by a legitimate compounding pharmacy who knows what they're doing. We need to, if you want to bring the cost down, we got to get the FDA to change their ridiculous policies that make no logical sense. That would help a lot. Okay. It needs to be available. This is a simple, like a vitamin, it's not hurting anyone. And look what it can do. We can't operate in fear. We have to operate in education. We have to operate in truth. We have to operate with reality, and we have to operate with values. We got to value human life. We got to value human function. It's not that complicated. We're doctors. All
right. Couldn't agree more. The patient comes first. If there's new modalities out there, we need to look at them. We need to study them. They need to be studied in true clinical trials compared to other existing treatments. I feel there's probably a meeting of multiple treatments to best deal with such a complex problem as addiction. So thank you so much for the discussion, Dr. Repass, Dr. Basha, and Tom. Thank you so much.
Thank you for having us.